Hello, hello. Welcome everybody to episode 93 of the No Normal Show for Thursday, February 18th, 2021, brought to you by Revive Health. This is our weekly deep dive into how hospital and health system marketers can navigate what we call the no normal. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health and your host for the show. I'm joined as always by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hello, Chase.
Chris, good to see you as always.
Good to see you too. We're also excited to be joined by Amy Comeau. Amy has 2 decades of marketing leadership experience in multiple industries, including healthcare, higher education, and the performing arts. As Vice President Marketing, she leads strategic marketing for Emory Healthcare's 3,000 physicians, 11 hospitals, and 250 plus locations, balancing brand management with customer acquisition, retention, and loyalty. An avid sports fan. Are you a Trae Young fan?
I am. We just watched him last night.
Okay, so I had to get that in there. You've played a key role in negotiating and now leveraging Emory Healthcare's partnerships with the Atlantic Hawks. For non-NBA fans, that's who Trae Young plays for, the Braves and the Falcons. Prior to joining Emory, Amy spent a decade leading marketing, communications, and ticketing for major performing arts organizations, including the Atlanta Opera. Amy, hello.
Hello. Good afternoon.
Thank you so much for joining us.
Oh, happy to be here. I'm delighted to participate and look forward to the discussion today.
Absolutely. We're going to dive into some really good stuff. First, I got to cover some housekeeping notes. If you're new to the show, if it's your first time listening to the show, either live or through other means, this is where we share industry trends, research, stories from those both within side healthcare and from out, anything we can to help health system marketers and communicators navigate the no normal successfully. If you're unclear what we mean by the no normal, if it's not intuitive, if you want to know more about the principles of the no normal, whatever, you can read a blog post that we wrote when we introduced the concept, which Chase will post a link to in the chat function. If you are live with us on the show attending, use that chat function to talk to other attendees. Also watch because Chase will be posting other links there as well as we go through as appropriate. If you have a question for us, if you have a question for Amy, for me, for Chase, put that in the Q&A queue. That's what we monitor as we're going through live, so we can make sure we answer any questions that you have. We may do that as we go. We've got time at the end. Just make sure you put them in the Q&A queue rather than the chat function so that we see them. And remember, you can subscribe to this podcast on iTunes or wherever you listen to podcasts. We also post a video recording of the show by the end of the day. You can find that at our website at thinkrevivehealth.com/no-normal. That's where all of the podcast recordings are. That is where you will find a short schedule of upcoming guests and topics. If you want to dive into all of our COVID-19 content, because boy, do we have a lot of that beyond just this show, you can find that at thinkrevivehealth.com/COVID-19. I think, Chase, we have some new consumer research. Is that report up and available yet? I know it's just like hot off the press, like maybe as of today or yesterday.
It's launching at 1:30, so we'll give people early access to the live people on the show. So yeah, I'll send a link.
Nice. It's some research we did around something we talked about on the show a little while ago, a few weeks ago, about who is the vaccine for, and the idea that there are so many people out there in the communities you serve that don't believe the vaccine is really for them in many different ways, and that is a real stumbling block to getting the folks in to get the vaccine that we need to. So I think the research helps support that, and is just more vaccine related research that can only be helpful because we're still in vaccine chaos. Amy, we're going to talk about this a little bit, but a big talker around our agency and among our clients and on this show the last couple of weeks is the struggle that we've had distributing vaccines, throughout the country, and in particular, some of the challenges that hospitals and health systems have faced, most of which are not of their own doing. They're kind of beholden to things that are beyond their control. And now we know that the federal government is shifting a lot of the distribution away from hospitals and health systems to a degree, or maybe completely, 2 retail pharmacies as an example. They're going to have federally operated distribution sites. So we just want to kind of keep our finger on the pulse of that. So I searched right before we went live here, just to see, you know, what's the, excuse me, the latest news on hospitals and vaccine distribution. And this is what I saw, and I think it's just a perfect setup for a quick conversation on this, because I'd love to hear where you guys are at, Amy. It's the results of my search, which was just vaccines hospital in Google. The top stories, there were 3 of them. Here are 2 of them. All right, they're both from yesterday. The first is from NBC News, and it says Michigan hospital system cancels nearly 2,000 COVID vaccinations due to major shortage. I think that was Beaumont, because I saw that article, right? So here's Michigan canceling. It's a hospital health system having to cancel lack of vaccines, lack of supply. Right below it, Miami Herald, day ago. Miami's Jackson Health on cusp of expanding COVID vaccine to include some of those 55 and up. So here we have the exact opposite story. And it just is like the perfect little snapshot of where we're at. So where are things at with Emory and Atlanta and Georgia? Speak a little bit to your situation, Amy.
Yeah, absolutely. So we've been doing vaccine distribution, obviously, to our employees since before Christmas. And then when our state actually moved into phase 1A right around Christmas, and announced actually during the Christmas break that we were going to expand phase 1A and make it phase 1A plus to include adults 65 and over starting in January. So we went from a great operation and getting as many of our employees vaccinated as possible to then quickly shifting to now how are we going to manage inquiries for our patients. At Emory Healthcare, we are only vaccinating our patients, so we've got a process in place to help vaccinate them. So that gives us some flexibility. So it's not just we're not vaccinating the general public like I know some other systems are. But it has been very fascinating. I mean, there was one point in time where we thought, oh, we're going to have to stop vaccine because of vaccine supply, and that was a short blip. And then, vaccine supply has been pretty steady for us. I mean, not huge amounts, but enough that we've been able to keep our vaccine operations going. But like even today, we heard there's a news report that our governor is going to do a press conference this afternoon. So we're not sure if he's going to announce moving into another phase or not. So we'll see. We're all kind of ready and on our toes, waiting and ready for what the next evolution or chapter in the vaccine story is going to be.
Yeah, that last part, Amy, just speaks to some of what we've been hearing from clients and others on the show and just in our networks of even a disconnect between the state governments, like you said, you don't even know what he's going to say, right? Like it just shows a bit of a disconnect of sometimes governors moving on and expanding access, but there are health systems that are saying, but we don't have enough to deal with the people that we're currently focused on, or we haven't got all the people that wanted a vaccine yet. We just haven't been able to get to them all. And so it's part of the conversation I think we've been having, Amy, I'd love your take on this, is it has been a rough go. In some cases, hospitals and health systems have kind of stepped in a little bit, but those have been few and far between. We've seen the stories, but overall, the challenges have really been for this kind of thing, right? Like not knowing where the state's going next, being beholden to others in terms of supply. How much is it? How quick do you get it? And so there's kind of like this debate of, is this going to be better for hospitals and health systems where they're not, the sole or maybe even the doing anything to do with distribution, because they will no longer be blamed for things out of their control, or to what degree does that not look good for the industry? That, we've heard governors of I don't know about your state, but other states say hospital and health system aren't moving fast enough, we're going to go outside. Not a good reputational message, right? Also the fear of driving people into theoretically competitors, a Walmart Health, a CVS, a Walgreens, at some level. So it's just this weird state, and I don't know if you've got a thought on that, but it's an ongoing combo we've been having.
Yeah, I mean, I've had conversations with friends of mine. So it'll be interesting once we get a few years out from this to go back and do a study on, what happened with vaccine distribution and where did things go wrong, where did things go right. But There's no doubt about it. I mean, at the end of the day, we want to make sure that as many people are vaccinated as possibly can, because that's how we get to hopefully a normal side of this at some point in time. Although we know there'll be no going back to the old normal, regardless. So, I mean, from my perspective, I kind of liken it to flu shots. So if the COVID vaccine ends up being annual, like, we've heard some studies, and it just becomes as regular and routine as a flu shot, then the way that we've done flu shots as an industry, I think has worked really well, because you get the vaccine out to all the retailers, right? So I get mine at Publix, because that's where I do my grocery shopping, and that's easy. It's actually easier for me to get my flu shot at Publix than it is for me to schedule time to go into my physician's office or even into employee health at my facility. So I think ideally that's where we should get to, that we've got enough supply of the vaccine that access isn't an issue. And so if it's more convenient for you to go to Walmart or Walgreens or Publix or Kroger to get it, or you can get it at your doctor's appointment or at your local health system, I think ideally that's where we should get. But the challenge right now is that there's not enough supply, and there's not enough supply to vaccinate everybody yet, and there's restrictions on who can get it, which makes it more complicated. I think for all of us, as a consumer and as a distributor, whether you're in the health system or a retailer or whatnot.
Yeah, 100%. And the other thing that we talked a little bit before the show started, and I'd like your take on this too, is we haven't had a lot of conversation nationally, and I haven't seen a lot of research on the concept of frustration. It's been primarily on how do we get those reluctant to take the vaccine to get in there? How do we make sure distribution is seamless as possible? But as this continues to go, and as you see headlines like I just saw, or you're in Minnesota, where we're behind other states in terms of who gets it, and you're like, hey, Chase gets it, and I don't get it. Like, I think I'm older than Chase. We're not sure, but I think I should get it before Chase, or my neighbor got it. At some point, we're a little worried that people are going to start getting very frustrated. And you already hear stories of people kind of trying to cut the line in different ways. And that's just another reputational risk, I think, anybody who's associated with this has to consider. We're going to start trying to look at that in our own research. To what degree is that happening, and what are the potential implications of it? But, I don't know if you hear that from any of your patients or staff or anybody.
Yeah, I mean, we haven't done any studies ourselves either, so everything I'm saying is sort of speculative, or what you hear on the streets, or rumor. Certainly, there are people that want it and can't get it, and then you hear stories of there's people who are line cutters, whether they said they were a caregiver and really weren't, or what have you. And certainly, at the end of the day, as long as people are getting vaccinated, it's a good thing, right? But it can be frustrating. It's human nature. It's frustrating if you're a person that follows the rules and said, "I'll wait until it's my turn," and then you found out your neighbor had less ethics or morals and did whatever they needed to do to get it. And so that's, unfortunately, that happens, and that's human nature. And I also think we've done the right thing by doing all the I got the shot, selfies, and everybody sharing their pictures when they get the vaccine, because we know that word of mouth at the end of the day is what's going to help combat vaccine hesitancy. So if somebody I know gets it and had a good experience, or said the side effects of dose 2 were worth it, then I'm going to be more likely to get it than anything that even Emory Healthcare is going to put out. But of course, we're going to put out as much as we can to combat that. But I think what that's done is created sort of a Me Too, or a competition, right? Yeah. So now you're like, I want to be able to post my own selfie. I want to say that I've got the shot. And so so in a way, we've sort of created it by trying to combat vaccine hesitancy, but now we're creating, it's classic supply and demand. It's, I'll use, like, there's a restaurant, right? You can never get a reservation to. And so everybody's clamoring to get a reservation. And finally you get it. You're like, no, this place wasn't all that great anyway, but I didn't get a chance to check in and post my selfie and said I was able to get into the right. Restaurant du jour. Of course, nobody's going to well, not many people.
A vaccine, days, I think, is the name of it.
Yeah, exactly. So it's interesting. It's interesting time.
Yeah, for sure. And I think the thing we're watching is, initially there was a lot of communication about how this needed to go and there need to be priorities. And I think most reasonable people understood it and we're like, yeah, that makes sense. Those people should go first and that's the right order. But every day that goes by, like every once in a while, I'll see an article and the headline will be, forget about prioritizing, give it to whoever it wants. Like that was a New York Times column just like 3 days ago. And that's the kind of thing where you're like, wait a second. I thought we were all on board with this, like, let's do this the right way. And then it's like,
Right.
throw plans to the wind, just whoever can get in. So we'll see how that goes. And we don't need to keep talking about it, but it's really great to continue to hear from people that are on the front lines dealing with this as we continue to kind of grapple with something that we're going to be grappling with at least through the spring into the summer in a significant way, right? But let's talk about why we had you here, which is really to kind of understand your perspective on, I think we could jokingly say, or you jokingly said, we've heard this before, like never let a good crisis go to waste, right? And of course, this is a crisis. It's very serious, and folks are dying and all of that. So we don't want to make light of it that way. But we have definitely seen for our audience opportunities for marketers and communicators to step forward in bigger, better, more valued ways within their organizations. And that's a good thing. That's a good thing for our peer group. It's a good thing that we're being recognized for the real value we can bring to the table. And it took a crisis to do that maybe, but we have to make sure that we're taking advantage of that, right? Not in a gratuitous way, but in a way that makes sense for everybody. That's only good for everybody, ourselves and our organizations. So let's talk about how that's been working for you. And I know one of the things you want to start with was the use of CRM, which is, also an ongoing journey for many people, in your shoes, in hospitals and health systems, trying to understand how best to use CRM. So maybe start there. Talk about your CRM strategy and what you've been able to do with COVID-19 that's helped you move that forward.
Yeah, no, absolutely. So CRM has been actually a career-long dream of mine, even back in the performing arts, wanting to bring CRM to life. And so once I got into healthcare and I realized the complexity of how we need to communicate with our patients and attract new patients, it's not as easy as it is for coffee companies or CPG retailers. So I was quickly on a evangelist, so to speak, or on a journey to bring CRM to Emory Healthcare, and it took a number of years. We were fortunate to do the socialization, build the business case for it. Later to the game than some of probably the bigger names in the industry that that have been on CRM, but we got it, we contracted it, and we actually executed our contract in October of 2019. And so a year ago, January, we did our first implementation meeting. We were getting ready to implement CRM, and our year one use case was going to be to launch 1 to 4 campaigns for marketing, right? We had a 3-year plan where we, by 3 years, we'd be using it for robust patient communications, integrating with our contact centers. But year one, let's just get the marketing part of this down, build some momentum, show the business case, show some ROI so that we can continue to socialize it. Well, COVID happened, and all of a sudden, we're on all these daily instant command center calls saying, oh my God, what are we doing to communicate with our patients? How are we communicating with our patients? So-and-so sent me an email. I'm getting emails from Delta and emails from so-and-so. What are we doing? And I was like, well, we have CRM. Let's take this as an opportunity to start to communicate with patients. So we went from not planning to use it for robust patient communications to now sending out a monthly email to 600,000 plus of our patients every single month.
That's a huge leap. That sounds so much like the numbers and the speed in terms of like virtual visits, right? Like we heard back in the spring of people going from 0 to 25,000 virtual visits a month in 4 weeks, that shift, right? And that's kind of the same deal, right? From going from 0, at least CRM based, of course you had patient communications, but in a managed way that way to now 600,000. So can you talk a little bit to the impact of that? What has that allowed you to do? How do you think that's benefited in terms of helping those patients or helping the organization?
Yeah, well, we've learned a lot about it. It's done two things. One is it's helped us, talking about never let a good crisis go to waste. It immediately brought the value that we as a team, as marketers, bring to the organization front and center. Like there was suddenly an urgent need for our help. Not that there wasn't urgent needs for our help previously, but this really, I mean, the point about a crisis is that you 100% focus on what's happening in front of you, and the entire organization is focused. So that helped us really get the resources we needed to enable the monthly patient emails. But we also talk about durable change at our organization. So what have we learned and what have we changed as an organization that's not just going to come and go with COVID, but really is going to be durable change? For us, I don't ever see the patient email the monthly emails going away. In fact, they'll just evolve, right? So we started out talking about safety. Then it evolved to here's how you can schedule telehealth appointments with us. And now it's been critical to us in how we communicate with our patients related to vaccine. So we're able to say early on, hey, you know what? Vaccines are coming. We don't have them. It's not ready for the general public yet or for patients, but you can go at our website and here's questions you can answer, get some FAQs answered for, what your questions are related to the vaccine. And then once we rolled into phase 1A, we're able to say, okay, here's where we are. We got to follow state and federal guidelines, but we're now opening up to here's how you can submit an appointment request and get on the waiting list. And if you're not on the, if it's not your phase, we'll hold you on the waiting list. So we're able to keep that constant stream of communications to our patients. I've heard anecdotally from some that it's been extremely helpful. Like they're thankful for the emails, and some of them we actually have come exactly, they're addressed from our CEO. So they feel like our CEO is actually talking to them individually. And so I think that's gone a long way with our patients and their comfort level.
I mean, it's such a great use of this technology. And I contrast it to my experience with my provider, where I haven't heard a single thing from them. I have to go search for information on the vaccine. It's not front and center. I have to dig like 5 or 6 levels down. And then the first time I did this was like a month ago. So it was kind of in the start of this. I wanted to understand, like, how are they, what are they doing to distribute it? So the first question, it was all only an FAQ. And the first question was something like, how do I know when, I can get my vaccine? And the answer was, we don't know when we're going to be able to get vaccines, so we can't answer. And then the second question was, do you have a waiting list for people? No, we don't have a waiting list. Like, that was it. That's all they said. It's like, well, come on. At a minimum, they could have emailed that to me, right? So then I would have been like, okay, I don't need to worry about this for a while. But, it was bad content and I had to go get it. They had my information, right? I mean, I had to go get it in some degree through the EMR. It's just, so it's so great to hear that, the kind of coming together of something that fortuitously you had started in January, and were able to leverage right away in a really important way.
Yeah, and honestly, I don't know how we would have done it without it. I'm so thankful that we had the tools in place, even though we were early in our journey, but we had them. I think about many of you are probably listening who, if you didn't have CRM or these tools, how you're managing your patient communications, and that would be, I would imagine it'd be a lot more challenging without having the tools than we've been fortunate to have.
For sure. Yeah. There's a question that came in. There was actually 2. I think we answered one of them, but the other one was, you mentioned, getting tested. You've talked about vaccines. What about kind of don't delay care? Have you incorporated that into your CRM communications, or to what degree have you?
Yeah. So, and Chase and I talked about this a little bit before, prepping for today's session. We, in the summer, we were very focused. After we thought, we all were naive and thought, oh, the first surge is over. Yay, now we can get back to normal life. That was kind of a pipe dream. But we were all then focused on, all right, now we're getting back to, we're doing our essential surgeries and elective surgeries are back up. What do we need to do to make sure that we're doing recovery marketing? I think we all came to know that language, recovery marketing. So we use CRM. That was what we purchased CRM for to begin with. And so we started with some very, very targeted campaigns, particularly around areas that had access, like MSK, heart and vascular in particular, to using propensity models to get the message out. But that's very, what I'll call surgical or very targeted. On the other hand, we also did some social media and broader based messaging around don't delay your care around the ED. So I think we all over the summer were worried, and we see the numbers drop, that we're not seeing the heart attacks and the strokes we normally see in our EDs. And so we partnered with some of our physicians to create content that we then pushed out through our social media, just reminding people that these are the things to watch out for, and here you still need to come back. And where it made sense for us to link to those in our monthly messages to patients, we did. Mostly we would just remind them to not delay their care, and that they can access us in whatever way they feel comfortable, whether it's telehealth or in person, because I think by the summer we were back up to doing a certain amount of in-person visits once we were able to figure out the social distancing and the new COVID protocols guidelines for having in-person back up and running.
Yeah, and this is, everybody knows this, I think, but this is still a real issue. It hasn't gone away. Maybe it's diminished a little bit. In fact, we just had somebody last night post some new research, which Chase can share the link. Chase, I slacked it to you, so if you want to pull the links there. But it continues to show that people are reluctant to come in if they don't have to. It was research done by the Society for Cardiovascular Angiography Interventions. Haven't heard of that group, but I'm sure they're legit, and there's more to that. So it's probably going to be with us for as long as COVID's with us, at least in a significant way, right? And so really important to continue with all that. So let's move on. Let's talk about something that seems to be a passion for you, and that's sponsorships. And obviously you've got a great situation there. Do you guys still have NHL? I can't remember. The Thrashers? Was the Thrashers?
It was the
right?
Thrashers. Yeah,
Yeah.
the Thrashers. I think they're the Winnipeg Jets now.
Oh, that's right.
I think they went to Winnipeg. Maybe they've moved on from Winnipeg, but yeah, they're not here anymore. So we don't have an NHL team. Haven't had one for a while.
Obviously a very huge metro for sports, a huge market for sports.
Absolutely.
So talk about partnerships, and it doesn't have to be at that level, whatever, community partners,
sure.
Whoever you're working with, in terms of how you're working with them during all of this.
Yeah, so I would say there's two ways we're working about it. Obviously, there's the way that we're working with the sports teams, and I'll talk about that. But then there's also how we had to transition our normal community engagement. I mean, we actually had a new community engagement function that pre-COVID was, the health fairs and the sponsorships and, doing the talks at senior centers and stuff like that. So we had to obviously cut that out and transition. And Cheryl's on my team, who manages all that. They are actually finding really tremendous success in doing talks with senior centers and community groups like we're doing right now. In fact, they're even more successful than the in-person, because you don't have to get people to come and travel. So they did one, I think it was last week, and they had 142 people participate. And normally in an in-person environment pre-COVID, 30 or 40 people attending would be a success story. So just thinking through, again, the durable change is using technology like this to communicate and stay connected with your community partners in a way that we just didn't think about previous.
Yeah, that's great. And just having to be able to be flexible and figure out how to do all this stuff virtually, that's just a whole new thing. How much of that do you think is this is something we're trying to pay attention to writ large, but how much of this do you think is going to stick? The idea that this is a lot easier, a lot of it virtually, right? And so just because COVID goes away, I don't know that a lot of the virtual dynamics, that not just virtual visits, but every element of it, that's just going to go back to the way it was.
Yeah, I've been thinking about that myself, because just even my team, we're all remote, and so we do all of our meetings remote. At some point, we're going to be back in the office again, but we'll have some sort of hybrid, which was a challenge that we had previous, where not everybody's in the same space. Some people are calling in, some people need to be connected, and having this virtual connection has been so much better for our team than the people who are dialing in, who aren't there, not in the room, feeling like they're not really engaged. So, I think there's going to be a hybrid. I think with the community events, I think they'll probably be, hey, these are our regular virtual events. It's great for physicians or the speakers because they also don't have to travel. I mean, they can do it from, the comfort of their own home or their office or wherever they are. But I know that people are going to crave getting back. There's nothing like being in person. Yeah. So I think it's going to take all of us to start thinking through strategically what really needs to be in person and what does that in-person event or environment look like, and what really is better suited for an environment like this that's virtual and allows more participation across the board.
Well, that's 100% true. And for some reason, what popped in my mind is the best example of that is a virtual happy hour. Like in some ways, those are almost painful to be in, right? Like you just want to be in a bar, you want to be in a restaurant, and it's just not the same. It's the same people, you're doing the same thing, and theoretically, you should be able to talk about the same stuff in the same way, but it is not the same. And man, I mean, I don't think I've done one of those in months. In the beginning, it was like, oh, isn't this great? And then after a while, you're just like, yeah, this isn't great. Well, I don't know what's wrong or what's off, but this is definitely off. I don't know if that's just me. That's a an N of one, but I'm pretty sure that there are other people that have that same experience, and that's just having a glass of wine, let alone working with people, right? So let's move on to the final topic, and that is creative, which is also another creative in messaging and all the ways you go to market. This is another talker that we've had within the agency, within our clients, and on this show. And that is, at what point are we going to be able to move on? And the answer depends. It depends on where you're at as an organization. It depends on how COVID is hitting your market. It depends on what we're talking about, right? We just got done talking about, making sure people are comfortable coming back in for care. Service line marketing has been going and probably should be going now and can continue to go. As long as the doors are open, you need to be moving people in for the care. Right. But I think where it becomes trickier is at a brand level. It would be hard to imagine somebody from a health system standpoint anyway, going out there with brand level creative and brand level messaging that isn't somehow connected to COVID. Whether we like it or not, it would be odd to hear from a hospital right now, and there's no mention of maybe not COVID explicitly, but our current state, where we're at, the situation in society, right? At some point, we'll be able to do that. Love to hear from you, how you think about that, where you think that kind of threshold may be, and how you're planning for it.
Yeah, it's a really great question, and actually one that we're dealing with right now. But we've really dealt with it really back to a year ago in March. And how do we found the need to be agile. I think on one of your previous podcasts you talked about agile marketing, and this probably isn't exactly agile marketing, but we realized that everyone, we all probably stopped our marketing in March because we're like, we can't be driving people into the system, so you stopped it all. But then we realized, well, we got to get back out there. But now, how can we get back out there quickly, effectively, cost efficiently? And how can we even try to predict the future, right? Because each phase of COVID, you're like, okay, how much of this do I need to be messaging about COVID specifically? And how much of this is, no, I need to be getting back to business and recovery marketing. So we followed a process where we'll call it, we tried to follow where the general public would be in the different phases of COVID. So are you low incidence rate, rising peak, the highest peak that you can imagine where you think you might have to shut down visits, and then where are you on the back end? And of course, again, we all naively thought it was just going to be a single hump, and it wasn't. But we looked at how do we prepare for content, and we focused on our television and our mass media to get across whatever the most important message was. Like, what is it that we want? What's the simple, most important message that we want people to know? And, in early COVID, it was, thank you for everybody rising to the call. Everybody was, giving donations. Everybody was really rallied around the health systems. And so we were proud of our city, and we wanted to share that and express thanks. So we did that. Then we created content following that on, all right, it's safe to come back, and here are all the safety measures we have in place, whether it's in person or online. So we try to pack a lot into about a 30-second spot. Both of those used all stock footage, right? All stock footage. And so it was faster to produce. And, our agency partner was amazing in helping us with that. But now we're at the point where, okay, now let's start thinking about what is next, right? So we're now at vaccines. We're not right now in the place where we're going to be spending advertising dollars to create a spot around vaccine hesitancy, because there's so much momentum, I think, nationally around vaccine. There's a lot of great content. We can manage that differently. So now how can we focus on having people take care of themselves and getting back to care? But looking at that in a way, do we need to produce it two different ways? Do we need to produce it with masks and without masks, or do we produce it in a way that is, omnipresent, that can transition from a high peak COVID rate to hopefully it's the point where we're down to very low transmission rate and back to going to live sports again. So it is challenging, but I think you've got to develop that flexibility to be always thinking ahead as to what content you're going to need, so you have it when you need it.
Yeah, and it's just, I think it's so hard to figure this out, because back in the summer, we started talking about what we called rapid recovery, and part of our message was, you've got a window, because we all assumed the flu was going to make this doubly worse, right? So you got a window to get people back in, because once we're in November, predictions are the flu's, we're going to be crushed. Well, the flu didn't happen. It didn't happen because people were social distancing and wearing masks and washing their hands, right, for the most part. And now, well, we should be getting out of this, but the variants are the big question mark. And I was just trying to find it, but there was an article yesterday that said, numbers looking great, but essentially experts scared to death about the variants. And you're just like, okay, so what does that look like? The numbers do look great now. They're going the right direction, but it said something like the variant was, and maybe this, spreading rapidly. So you say, like, well, if the cases are going down and the deaths are going down, I don't see anything spreading rapidly. So it's just so hard to know. It's so hard to know when are we going to get through all this? So I don't know. I don't know if you have any kind of take on how you guys are thinking about that.
Yeah, I mean, I don't know that we're looking at the variants any differently in how we're messaging. It's more, it's the same, the 3 W's messaging, wear a mask, wash your hands, watch your distance is going to help no matter what, and get vaccinated. Those are the things that are going to help against it. But I think to your point of not being able to predict the future, what we're finding now, I mean, all of our health systems, right, have found I don't say a confidence, but we've developed the capabilities to actually run almost 2 different systems in parallel. You have the system, and our CEO talked about this. There's a system that we're running a COVID health system and a regular health system side by side. During the first surge, we couldn't do that. We didn't know how to do that. So we had to stop the regular business so that we could focus on the COVID. Well, then the second surge taught us, here's how we can bring those 2 together. And then the third surge ended up being worse than any of the 2 previous ones. And we're continuing to, operate at almost 95, 100% of, surgical capacity and care for COVID patients. So you got to keep both of those running and work on messaging that you can either dial up or dial down depending on what the state of affairs is. But if you wait for the future to happen, you're already going to be behind the 8 ball, and then you're just going to be scrambling to catch up.
Yeah, for sure. All right, so this has been great. A question just came in, so let's tackle this question before we sign off. For advertising, are you willing to share which channels you're using or finding the most success with?
Yeah, so we've seen a lot change, consumer behavior change over the year, right? We don't see rush hour traffic as much as we did. So where last, previous to COVID, I don't know if you know Atlanta, but Atlanta's got terrible traffic. I think only second to perhaps LA or maybe New York. So we had a lot of drive time radio. That was part of what we did previous. Now we're shifting that into, online podcasting. We're seeing a lot more in streaming. So we're shifting based off of where we're seeing our consumers go to. in that way. And then obviously things like Google AdWords and, you know, programmatic digital and everything, those are always mainstays regardless of what's happening. But interesting to follow the trends with TV and radio in particular.
Yeah, for sure. Are there any specific service areas you're focusing on? Are you focusing on top of the funnel? So urgent care, emergent care, primary care? You focus still, you know, a lot of folks still focusing on that specialty care because that's what people are, you know, they're putting off both. In fact, they're probably putting off that top of the funnel care more because, well, I can get by without my checkup, right? I can get by without my diabetes consult and all of that. But is there anywhere that you're focusing, prioritizing your marketing?
Yeah, so the priorities don't change tremendously pre-COVID versus during COVID. I mean, at pre-COVID, we were focused on the big drivers of revenue, like probably many others, you know, orthopedics, heart, cancer, primary care as a feeder, right, as a base. So we're still looking at that, where we can drive high revenue, high margin services into the system, because at the end of the day, it's a business. But then also looking at where are we concerned that people are putting off care, and that by the time they do get to us, they're going to be sicker than they would have if they've come in. And so we're concerned from a cancer perspective around, you know, what we've heard is declining rates of mammography and how much breast cancer might be going undetected. I mean, that's one example. So we're still focusing on the usual suspects, but just in a different way. What revenue do we need to bring in and bring in now versus where do we think we need to make sure that people are getting in so they're not, their outcomes aren't worse off later on.
Okay, perfect. I think it's a great place to wrap. I have one more question for you. It's a personal question because I just caught myself doing this. Are we still not supposed to touch our faces? Like that was a huge thing a year ago. Like wear your mask, social distance, wash your hand, and don't remember. Like there was a woman like at the COVID. I don't know if she was on the COVID task force, and she was like, one of the things people shouldn't be doing is touching. She was literally touching her face as she was saying, "Don't touch your face." Is that still a thing?
Yeah.
I should know that.
I imagine, yeah, you know, you don't really hear people messaging it that much. I think now maybe it's if you're home and you're alone and you're washing your hands all the time, then it doesn't really matter if you touch your face. I don't know. That piece of the touching your face has really sort of dropped off as a message point. But I think it is because so many people are, you know, isolating, and that it was more when everybody was still out in the public and making sure they were washing your hands, you know, when don't touch your face after you go to the grocery store or stuff like that. But that's a funny question. I had actually thought about it the other day too. I'm like, you don't really hear people talking about that anymore.
That was back when we used to like scrub down our Amazon deliveries too. Like you'd pick it up with your gloves and you'd wipe it all down. You do that with your groceries. Like there were blog posts and stories about how to wipe down your groceries from the store. So maybe it went away with that too. But anyway, thank you so much.
Learned.
Yeah, that's right.
Yeah, it's my pleasure.
Thank you so much. Yeah, it was great to have you. Chase, as always, thank you, sir.
Yeah, I really enjoyed it.
If there's anything you'd like us to cover, let us know that. If you're with us live, put it in the chat function before you take off. Or you can email us at nonormal@thinkrevivehealth.com. We'd love to hear from you about topics you'd like us to cover. Remember to visit thinkrevivehealth.com/COVID-19 for all of our COVID research, reporting, intel, insights, and you can also get to the latest recording of this show or other shows through that, or subscribe on iTunes. And as always, good luck out there. Till next week in the No Normal. Thanks, everybody.